My name is Walker Hagan, and I'm the NMJ team lead for Hesperos, the human on a chip company. I'll be walking you through the human on a chip neuromuscular junction model for the evaluation of botulinum neurotoxin. So traditional methods utilize the mouse lethality assay for determining the potency of botulinum neurotoxin. And this assay is very costly and sacrifices thousands of mice per year. In addition, it's not relevant to the human physiology. There have been in vitro studies to assess the potency of botulinum neurotoxin, but even though that potency determination can be made, it's not relevant to the actual function at the NMJ. Multiple publications have shown that between different manufacturers and serotypes, they can identify a common potency in the in vitro studies. But once they move into dosing intramuscularly, there's a difference in the efficacy with the same potency. This has led to different clinical guidelines for different manufacturers of Botox, botulinum neurotoxin, and a resulting difference in the actual efficacy based on the dose delivered. So there's currently a need to assess the potency of botulinum neurotoxin in a human-based model. To do that, we've established a co-culture using iPSC-derived human-based motor neurons and skeletal muscle, and we are able to identify functional parameters through phase contrast imaging. So for our co-culture model, we have a specific device that we construct in-house, and we can plate motor neurons on one side and skeletal muscle on the other. This device is chemically and electrically separated, so we're able to dose on specific sides and electrically stimulate on specific sides to determine responses. As part of our workflow, we utilize an automated testing machine that we've built to operate within an incubator. An operator can push start and it will be able to measure all of the functional responses from and dose systems. Then we utilize a machine learning analysis program that we've developed in-house to be able to quantify the specific functional metrics that we're looking at. And in particular, the functional readouts that we're able to determine are the NMJ number, the fidelity of the contractile response from motor neuron stimulation, and the fatigue of these systems. We can also perform additional supplemental assays such as ICC, supernatant collection for ELISA, cytokine analysis, and so on. So for this model, we've dosed with two different paradigms for acute and chronic dosing. And in our system, we've evaluated the functional parameters to determine the effects of botulinum toxin. In particular, with an acute dosing paradigm, we can see differences in the EC50 based on which functional metric we're looking at. So in case of amplitude, we see a sharp decline in an acute system within 3 hours. For NMJ number, we see a decline, but for fidelity, we only see a stronger response at the higher frequencies. Alternatively, once we look at chronic dosing, we see a strong decline in the NMJ number with increasing concentrations and an increase in the fatigue of the systems.